For Aksha, I'm Anna Dolosky. Our hearts are heavy today as we mourn the loss of our very own Aksha founder and president, Dr. Elizabeth Whelan. Beth was a giant in the annals of public health. With postgraduate degrees from Yale and Harvard, she grew increasingly frustrated with the discrepancy between fact-based scientific truth and the distorted information the public was hearing and reading from the media. And unlike many of her colleagues, she resolved to do something about it. As a result, in 1978, the American Council on Science and Health was born.
I'm Dr. Elizabeth Whelan, President of the American Council on Science and Health.
By sheer force of will, Beth recruited several figures in epidemiology, science, and public health. These included Nobel Peace Prize winner Dr. Norman Borlaug, the man credited with saving more lives than any other human being, and Dr. Frederick Stare, founding chairman of the Harvard School of Public Health Nutrition Department. Soon, countless experts flocked to join. Now more than 350 scientists and policy experts are part of Aksha's Board of Scientific Advisors. Aksha's headquarters began and remains in New York City, where Beth first assembled a staff of scientific professionals. Before long, publication after publication, book after book, all strictly devoted to the concepts of sound sciences, began to flow. Every effort she inspired promoted the mantra of evidence-based science while countering hysteria spread by the media and agenda-driven activists.
You've got to remember that our ability to find chemicals, for example, in blood, is become so sophisticated that we can find traces of anything in anything. And the fact that you've identified it in blood does not mean it poses a hazard.
Beth firmly believed that the destructive myths and nonsense posing as scientific truth were only allowed to exist because of what she termed mute science, competent expert scientists who failed to speak up against junk science. Here's Aksha's medical director, Dr. Gilbert Ross, with more.
It has to be emphasized what a wonderful woman she was, and how, for me personally, she really plucked me from the drink, basically, and put me on a lifeboat. And as soon as we spoke for the first time in 1998, we both realized how much we had in common. The disgust we both had for what was passing for science in the public forum and in the media, promoted by agenda-driven activist groups who were compromising and distorting science for their own purposes. And here was this organization, which I frankly had never heard of, which encouraged scientists actually to speak out against this kind of agenda and hysteria and alarmism and sensationalism so loved by the media, which helped to promote everything that was that science should be against. And I felt exactly the same way, although in my career as a practicing internist, I never really had a chance to elocute it or implement it. So we found an ideal working partnership. When she first started looking into the topic of the media distortion and the activist distortion of science, she resolved, unlike many of her colleagues who were just out of college and graduate school, who took note of the same things but said, oh, well, that's the way the world works, and went back to their research labs or their practices or their dissertations. Beth said, no, thus far and no farther. And she resolved to do something about it. She's written about nutrition and parenting and attacking junk science and mythology, food fads. She's co-written books with many known experts, and for those reasons alone, she'll remain in the panoply of gods and goddesses of epidemiology. But none of these dry tomes, these manuscripts, can reflect her passion and her personal warmth and leadership. Her legacy will live on. Aksha will live on. I would say stronger than ever, but it's hard to say that with a straight face, knowing that she's not here anymore. But her inspiration is here, and it will live on with all of us. And to that extent, Aksha will possibly continue to grow and grow stronger even. Keeping her inspiration and her devotion as a lighthouse, basically calling us in the right direction. All that being said, it's just hard to imagine when I came here today that she's no longer with us. It's just everything looks the same, but it looks completely different.
Many friends, colleagues, and admirers have also expressed their sympathy and praise for Beth's accomplishments. Beth was a great public health activist who reduced many deadly diseases and exposed many phony health scares and frauds. Indeed, she brought science to the dialogue on health and had a profound impact in many areas. She will be hard to replace. Our hearts, of course, go out to Beth's wonderful family at this immeasurable time of loss. We wish them peace and comfort. Beth's legacy will live on long past her brief time on Earth. Her commitment to the precepts of sound science have passed on to all who knew her, including all of us here at ACTIA.